respiratory diseases and their prevention, intensive care unit. Respiratory system may experience serious malfunction. The influence of unfavorable factors, hereditary predisposition to a number of disorders, evolution of the principles of a healthy lifestyle often lead to serious somatic disorders, including influence diseases. Infectious diseases of a respiratory tract are divided into airborne and Droplet-dust. When infections are transmitted by a contact with a sick person while talking, coughing, or sneezing, Droplet-dust infections are transmitted by contact with objects that the patient has used. Acute inflammation of the upper respiratory tract is a common disease, especially in urban-type settlements. Dust pollution of a neat breathe air with a high level of exhaust gases. All this adds up to an unfavorable picture and contributes to the spread of the acute respiratory infections, acute respiratory disorders, and acute respiratory vital infections (ARVI). And the difference between these disorders is that ARVI is vital in nature, and acute respiratory infections are bacterial. The surface of infections is a sick person who already releases the virus at the beginning of the disease, infections others. The main route of infections is airborne. Since the patient saliva related with coughing is saturated with pathogenic pathogens. The second way of infections is food. Infections are caused by the virus entering the gastrointestinal tract. Unwashed hands and food. Non-compliance with hygiene measures contributes to the spread of acute respiratory vital infections, but an equally important factor is a disorder in immunity. A person is protected from surrounding pathogens by an immune barrier, but unsatisfactory nutrition, poor environmental conditions, and stress negatively affect the immune system, respectively. A person may be more likely to develop acute respiratory infections of ARVI. Reduced protective properties of the body, hypothermia, reduced protective proteins of the body, hypothermia, chronic intoxication due to alcohol abuse or smoking. All this also increases the frequency of acute respiratory infections or ARVI. Acute respiratory infections or acute respiratory vital infections are characterized by symptoms of a common infections syndrome: chills, headache, weakness, fever, edema, and respiratory tract damage. In addition to acute respiratory infections or ARVI, there are a number of acute and chronic airway diseases. This inflammation of a nasal mucosa is expressed in a chronic runny nose, contact disagree from the nose, difficulty breathing. Pharyngitis is an inflammation of a pharyngeal mucosa. The main symptoms are cold throat, pain when swallowing. Laryngitis, inflammation to the larynx, is manifested by the hoarseness of the voice, backing cough. Tonsillitis is an inflammation in garment of a tonsil which makes it difficult to swallow. Bronchitis is an acute or chronic inflammation of a bronchi. At first, the disease may resemble inflammation of the upper respiratory tract, tonsils, or rhinos. But then the infection goes down to the bronchi, the inflammation develops. The main sign of bronchitis as a cough with a small amount of sputum released. The chronic from the bronchitis is characterized by constant course of inflammatory process. A special form of this disease, obstructive bronchitis, which often develops of smokers. The disease of characterized by a disease in the lumen of bronchi, evolution of a normal cause of ventilation of gas exchange process. Despite the apparent harmlessness of the disease, many of them cause complications with impaired temperament. There are known causes of disease occur due to infection and the rapid development of inflammatory infections. In addition, the flu virus, for example, is constantly mutating, changing, so only doctor can determine the cause and constitutive agent of the inflammatory process that has occurred in a patents. Self-medication taking well-known but useless drugs in same cases will not save you from negative consequences if you don't contact the clinic for specialist advice. Dangerous respiratory disease include bronchial asthma, a chronic disease, the main symptom of which is difficulty breathing. Narrowing of the bronchial lumen occurs due to the influence of various factors, most often allergic reactions to irritants. An allergy is an oversensitivity of the immune system to a certain type of irritant, expressed in the manifestation of pathological reaction. Acute edema or bronchitism of an allergic nature is a dangerous and a common symptom caused by a hereditary predisposition. An asthma attack begins suddenly with a dry cough, followed by a suffocation, difficulty breathing, and wheezing when exhaling. At this time, it's necessary to quickly take bronchodilator medications. The disease is dangerous with suddenness and acute course. Pneumonia is an inflammatory process in the pulmonary alveoli of the smallest bronchi. Inflammation of the lungs occurs due to the penetration and the development of a bacterial or viral infection. The worst of the disease is acute. Chills, high body temperature, weakness, cough, shortness of breath. A blood test shows the increase in the number of the white blood cells. X-ray examination shows a significant breaking in the lungs, the result of the development of fossil inflammation. It's clear that self-terminant in this case isn't only fluid, but also deadly. Tuberculosis is a chronic infectious disease caused by the causative agent Hox bacills. Tuberculosis patient with a cough releases sputum with a large number of pathogens into the air. In addition, tuberculosis patients are very resistant to environment factors. Tuberculosis affects not only the lungs, but also the kidneys, urinary system, and bones. Very often, tuberculosis begins as pneumonia, so main positive measure is a fluorogram, which must be done regularly. Prevention of disease of the respiratory system is as follows. Compliance with the rules of personal hygiene and daily routine, proper food nutrition, physical education, taking vitamin proportions in the cause of painful symptoms, timely consult a doctor. The basis of any prevention is knowledge of the causes of conditions of disease.